which is in partnership with Anna Ji Bharekar and International Academy. There also we can show the students how we practice Ayurveda. Tanman, there are 10 Ayurvedic faculty members who go there and work. It is about 27 kilometers from Pune, situated in a beautiful uh, country area side. Yes. Well, actually speaking, the International Academy of Ayurveda is probably the only NGO which has 30 international affiliations in all 5 continents. Few of them are very important. For instance, we have affiliation with Shuddha Dharma Mandal in Brazil. We have affiliation with Dancing Ayurveda and Yoga School in Encinitas, California, USA. We also have an excellent affiliation with MIU in Lisbon, Portugal. And other areas also, we have an MOU, Memorandum of Understanding, so that we can exchange our views, we can exchange our programs also. We also organize international seminars and national seminars. For international seminars, we have an excellent association with International Maharishi Ayurveda Foundation, whose chairman is Dr. Reinhard Picha, and he is one of the presenters today. He will be talking on Transcendental Meditation. With cooperation with International Maharishi Ayurveda Foundation, we have so far had 6 international conferences in different countries, and the next one will be in 2021 in Kathmandu, Nepal. We have also 8 Indian satellite centers. 2 are in Bangalore and others are in Pune, out of which the important one is Ayurveda for You. This particular center is conducted by Dr. Shashi Patwardhan, and with Ayurveda for You center, we conduct lots of online Ayurveda courses, and the most important thing is that we publish a monthly e-newsletter which goes to almost 40,000 subscribers across the globe. So this is a very important activity of ayurvedaforyou.com, and I think this is enough for International Academy of Ayurveda today as an introduction. We have our website, and if you have any other, if you want any other information, you can go to the website and get the information. Let's talk about the basic principles of Ayurveda very briefly, because these principles will be referred by next presenters, and it is better to have the concept of these principles for new viewers who are not accustomed to Ayurvedic terminology. So Ayurveda is not only a medicine, it's a science of lifestyle. And there are striking differences between Ayurveda and other allied medical branches or medical systems, let's say. For instance, Ayurveda is a holistic science. It's a healing science, and it takes into understanding the body, mind, and soul as a one unit together. Therefore, Ayurveda is such a science that it leads to spirituality also. And this is a striking difference between Ayurveda and other medical systems. Because moksha is one of the important goals of the life according to Ayurveda. Similarly, Ayurveda is an active medicine. It's not a passive medicine. For instance, if you are healthy, you must do some efforts from your side. If you are sick, then also you have to follow certain rituals and do some active processes like taking panchakarma or shuddhi kriya. So this is the basic difference between Ayurveda and Western medicine or any other type of medicine. So let's see briefly what are the basic principles of Ayurveda. Ayurveda is actually fundamentally based on different philosophies, and this is also very important because no other medicine is based on philosophical understanding. There are six philosophies, Darshana Shastras, out of which Sankhya, Yoga and Vaisheshik are very close to Ayurveda. In fact, our ancient sages or scientists were constantly observing the universe because they wanted to solve the riddle of how the universe came into existence. They knew the first principle of Ayurveda very well is that man is miniature of nature. Nature is macrocosmos, man is microcosmos, which means whatever the principles are present in the nature are also present in the man in a minute form. And that's why they were studying the universe. They found out that this entire universe is evolved out of three important omni substances: sattva, rajas, and tamas. Sattva is intelligence and light, rajas is turbulence or movement, and tamas is inertia or darkness. So, out of the permutation and combination of these three omni substances, the universe was evolved, was created. From these three omni substances, then came the five primordial elements: ether or space, air or the movement, water or the liquidity, uh, fire, heat, agni or light, and earth is solidity. So once again, ether, air, fire, water, and earth. These five are called as Mahabhutas or primordial pentats, and they are responsible for the structure of the universe as well as man. Is formed. From the combination of primordial pentats, three doshas or three biohumors are formed: Vata, Pitta, and Kapha. And their subtle essences in the body are also important, namely prana. The entire physiology of the human body. We also have channels or srotasas in our body or systems, like for instance, pranava srotas, that can be equated to similarly to the respiratory system, which gets affected mainly in COVID-19, uh, COVID disease that we are going to discuss further. So once again, just to enumerate these principles are fundamental principles are three gunas, sattva, rajas, tamas, primordial pentats, five mahabhutas, which are responsible for the construction of universe and for the formation of human being, three doshas, vata, pitta, and kapha, which are combinations of ether and air forms vata. Pitta is formed out of fire and little amount of water, and kapha is formed out of water and earth. Then we have also 14 channels, and there this is the entire things about basic principles of Ayurveda that I wanted to talk. Let's talk about COVID-19 pandemic. Now, since ages, the world has seen lots of pandemic diseases. For instance, this is the biggest pandemic that we are facing today, but before that, in 1918, there was the first pandemic, and that was called as Spanish flu. Actually, it's originated in Kansas City in United States, but then came to Italy and did havoc. Millions of people died because of this Spanish flu. Then, of course, there were many minor epidemics like AIDS epidemic, H1N1, swine flu, and others. But COVID-19, WHO has declared that this is a massive pandemic which has caused not only health problems, but social problems, economic problems, and environmental problems in the entire world. It has affected 195 countries in the world plus 24 territories. That means not a single land on this earth has remained without COVID being entered there. So What happens with the COVID-19 disease is it's a coronavirus disease 1919 because it was found out in November, December 2019. Ayurveda has always emphasized that prevention is the best measure for for keeping yourself healthy, and this we have to observe very strictly while defending ourselves and keeping ourselves healthy. Three principles like physical distancing, wearing continuously mask when you are in the affinity in the community or talking to other individual, and personal and social hygiene are also important. So this is what I wanted to tell you about the International Academy of Ayurveda, basic principles of Ayurveda, and a very small introduction to COVID-19 because the next presenters will be talking at length about all these things. Over to Dr. Sunanda, moderator.
Thank you very much, Dr. Ranade. Our first speaker is Dr. Mahesh Sabade, who is MD in Kaya Chikitsa and Panchakarma, and who is doing his practice since last 20 years. And he is also attached to Tanman, and he has written the book and visited many countries to give the lectures on Ayurveda for the propagation of Ayurveda. He is talking on the pathophysiology of the COVID-19. I will hand over to Dr. Mahesh Sabade. You can go ahead. Thank you.
Thank you, madam. Thank you, sir, for a wonderful introduction, and thank you, madam, for my introduction. So before I start talking, I'll just share my screen so that everyone can be visible, everyone can see the PowerPoint presentation here. Hello, everyone. Thank you for listening. It's a pleasure to be here. And so we'll be discussing COVID-19 and what Ayurveda's approach is, what Ayurveda looks into such kinds of diseases which are not mentioned in Ayurvedic texts. So we'll be discussing all that. Along with that, we'll be talking about herbs, immunity, and different other measures. So to begin with my subject, let me give you a background of COVID-19 in India. So basically in India, when the disease got started, so initially it was primarily the role of Western medicine as per the government's rule. So the Western medicine was dealing with all kinds of patients related to COVID-19. But recently Ayurveda has started treating mild to moderate cases who are suffering from COVID-19. And as far as prevention is concerned, Ayurveda has always been there right from the beginning, and it has given good results so far. So now we will start talking about the Ayurveda and COVID-19. So when we say Ayurveda, so most of us are Ayurvedic practitioners, some of new to Ayurveda, some of you are Ayurveda students. So let me go with a little bit of basics, whatever Dr. Subhash Ranade has said. On top of that, I'll speak about few things. So basically, when we say Ayurveda, so how exactly Ayurveda looks into physiology and pathophysiology or pathology. So as we all know, Ayurveda has its own paradigm. Ayurveda looks into various aspects of the functions from a different perspective. Ayurveda has a terminology of Vata, Pitta, Kapha, Doshas, Dhatu, Mala. So these are the fundamental constituents, above fundamental elements, these are the constituents, biological constituents, which are present in the body, which are known to perform various functions inside the body. And whenever there is any kind of derangement in these body constituents, so it has potential to create. So the most important to understand here is that whenever we think about any disease, it cannot escape the foundation of dosha, dhatu, and along with that, of course, mind plays an important role, mind and soul. They are along with dosha, dhatu, mala. So in Ayurveda, you cannot escape mind from the body and body from the mind. So on the same lines, even the psychological disorders mentioned in Ayurveda have biological origin. And that's why whenever we treat any kind of psychological disorders, we think about body, we think about dosha, dhatu, and mala. So my point here is that it could be any disease. We cannot get away from dosha, dhatu, and mala. So that's the most important point we need to keep in mind. So now, if we go beyond that, so as we know, every disease is understood in terms of dosha, dhatu, and mala. So how do Ayurveda and what does Ayurveda think about um, viruses, bacteria, or bacterial and viral infections? So basically, as per Ayurveda's theory, the derangement that is supposed to happen, that is amongst the bodily constituents, dosha, dhatu, and mala. So on those lines, viruses and bacteria act as the triggering factors. So those are the triggering factors which create some kind of disruption in the bodily mechanism, in the body constituents, and then that disruption leads to second thing, and then one leads to another, and the disease gets manifested. So that is the theory of Ayurveda as far as any viral or bacterial infection is concerned. So now, keeping that in mind, even though there is a viral infection or a bacterial infection, we don't have to uh, focus on viruses, but in fact, we can focus on your present status of your body, and then accordingly we can deal with it. Now, at the same point, one more point we need to understand is that whenever you have your dosha in perfect health, which means doshas are in a normal range, dhatus do not have any kind of vulnerability, dhatus are healthy enough, malas or the West are getting channelized in a very proper manner. So that in a way equates to a good health. And when you have that kind of status, so that is the same thing we nowadays are calling it as immunity. So we all need to strive to attain to that level where we have excellence of every constituent of the body, and in a way we will prevent these many infections, or in other words, our body will be self-sufficient to deal with so-called infections that are coming from outside. Just to stress my point, I have a few examples here. So the best example is of tuberculosis. So as the whole world knows that tuberculosis is a disease that got started because, that got manifested because of Mycobacterium tuberculosis. So now this is kind of a well accepted fact, but several thousand years ago, Ayurvedic texts, Charak Samhita, Sushrut Samhita, they have a mention of this disease. They called it Rajayakshma, and the same disease, but their focus was completely different, and they focused it as depletion of all the dhatus, depletion of all the tissues. And as we see nowadays, so whenever we have so many health workers working in tuberculosis wards, but unless and until they have depletion in dhatus, they do not get infected because of tuberculosis, and they won't manifest into tuberculosis. So that is something which is the importance of immunity and the strength in your dhatus. On the same lines, measles, chickenpox, hepatitis. So these are conditions which are known to be viral infections. And in those viral infections, in those conditions, we treat them rather than focusing on viruses, we focus on doshas, primarily pitta, and also dhatus, and we work on them and we treat those particular conditions. So this is what the whole picture of our concept of understanding disease is. So from that perspective, if we take a look at the next slide, which will happen in a minute. So what we can see is that the most important aspect for any kind of disease is vitiation doshas. Second thing, which is vulnerability in dhatus, weak agni, and when these things come together, then the disease will happen. So in a way, to prevent a disease from happening, we'll have to focus on these aspects, and we can build strength so that we can build immunity. Give me a minute. The slide is still getting uploaded. I'll try doing that again.
You can talk without the slide also.
Sure. Yeah, that is always an option. Yeah. Okay. So
Yeah.
another important aspect I would like to share with you all is that as we are seeing COVID-19 patients all around the world, so there are few important aspects that we came to know about this disease. So initially, when the disease got manifested, disease got emerged. So the focus was primarily on the respiratory system. So, and we now also we see the primary impact is on respiratory system, but at the same time, there is involvement of circulatory system. We cannot forget that. And on the same lines, there are patients who are showing specific hemorrhagic conditions bleeding in during COVID-19 complications. Another recent finding, which is incidence of Bell's palsy. So that is another thing which, according to Ayurveda, gives us an idea that there could be involvement of Vat or severe form of dryness, which is allowing Vat to increase. So these are few points we have to keep in mind. So on the same lines, when we think about the disease COVID-19, so it gives us specific idea about different categories of symptoms or 3 different categories of patients. So a major chunk of patients is of asymptomatic, which do not have any kind of symptom. And recently we came to know that many of the patients have seen that various antibodies have got developed in them. So that is one category. The second category, which is of mild and moderate symptoms, where we are seeing patients suffering from fatigue, sneezing, fever, anosmia. In some cases, diarrhea is there, body ache is one of the major symptoms, and excessive thirst. And the third category, which we are seeing, it shows patients with severe symptoms and complications. And these severity is ranging from affecting various organs up to creating various kind of life-threatening situations, life-threatening conditions. So these include hepatitis, myocarditis, GI symptoms, like this, various kinds of conditions, what we are seeing in patients. So now we will be talking about the samprapti. What exactly could be happening in the patients of COVID-19? So this is basically a hypothetical samprapti, which is a thought based on the observations what we are seeing in patients, as well as in the research articles, research papers, what we have been finding. So according to Ayurveda, because of the viral infection that happens, so it is triggering pitta primarily, or it is allowing heat to aggravate in a tremendous manner, which is allowing excess amount of dryness and raised temperature to manifest, which is in a way showing it as a fever. In many patients who already have sufficient amount of kapha in the body, so this is not getting manifested in a very clear-cut manner. And that's the reason why many patients are seen asymptomatic. Now, when this excess amount of heat is present in the body, so that heat, as we all know, has potential to cause burning action, cause drying action. So on the same lines, this heat, because of the heat and dryness in it, it is allowing excess amount of fluid, excess amount of water to get pulled from different tissues, different dhatus, and get accumulated in particular area. And that excess amount of fluid, excess amount of water that is getting pulled, because of the homologous nature with kapha dosh, it is increasing kapha dosh. This is what exactly could be happening in the patients. in Ayurvedic terminology, this particular phenomenon is called as Syandha. And this Sandhya is mimicking initially the symptoms of kapha, but actually at its base, there is a lot of pitta aggravation seen in many patients. So now, if we have to look at this particular situation in a little structured manner, so we can see these patients in three different phases. So the first phase, where pitta aggravation or heat aggravation is one of the main symptoms, or that's the first thing that happens to the patients. Because of the heat, the dryness and exacerbation of the heat that happens. Because of the heat, typically fever, thirst, fatigue, discomfort, those are the symptoms which are getting manifested. So now, keeping these symptoms in mind, we can look at different other diseases which may have similar kind of pattern. And we have found that herpes zoster, that too typically without rash, which is zoster syn herpid. So that is a condition which doesn't manifest or doesn't show any kind of rash, but it has exact amount of inflammation present in the patient, and that could be similar to this phase 1. So in the phase 2, because of the heat, it's a bodily mechanism, bodily compensatory mechanism, which allows excess amount of fluid to get pulled to pacify the heat. And in that whole process, that excess amount of fluid, excess amount of water is aggravating kapha dosh in the body, which typically is showing certain symptoms like sneezing, in some patients cough also, and typically anosmia, which is typically causing a symptom of lack of smell. So that is what we can call it as phase 2. Many of patients, I would say, are getting treated in phase 2 only. Very few people who already have aggravated state of pitta and vata in their body, which typically is seen in elderly patients, especially in Italy. So as the becomes, the excess moisture that gets dried up because of the heat, because of the dryness and the heat present in the body. So that has started now creating impact on the vascular part. So the vascular damage starts happening at that point, and then the hemorrhages can happen. And because of the vascular damage, there is tremendous amount of inflammation, which according to Ayurveda can be seen as a very specific pitta related symptoms. And those inflammation or inflammatory conditions can be seen in form of, let's say, pneumonitis, hepatitis, hemorrhagic condition. So those are typical set of symptoms which is happening. And if we have to look at the similarities, we can typically see the similarities of these patients in complications of herpes zoster. So that's what we are typically observing in the patients. Now, as far as the role of Ayurveda is concerned, so when we look at the patients, when we look at the systems involved in it, we have to plan herbs accordingly. So as far as respiratory symptoms are concerned, which are primarily related to kapha and also vata related symptoms, so in that particular situation, we need to work on vata and kapha pacifying herbs. We can focus on kapha reducing, like kapha reducing, and herbs that are beneficial for cough and pratishtha, which are affecting respiratory system. So that will be the primary area there. And when we see there is involvement of circulatory system, so we need to start herbs which have pitta pacifying action. So pitta pacifying herbs have to be given. So now another important thing I would like to stress upon is that whenever we are treating respiratory systems, it is important to keep in mind that we are not using pitta increasing herbs. For example, whenever we are talking about fever, whenever we are talking about pratishtha, so we are very much inclined towards using Lakshmi Narayan or
I'm sorry, but you have to conclude the session now.
Yeah, just a minute. So like this, kalpas or the medicines which are potent, which have drying effect, so that may aggravate pitta. So that is something we have to keep in mind. And then the last stage which I want to mention here in a stage where inflammation and cytokine release, cytokine storm is the main factor. So that's the area where we can treat the condition specifically for pitta, specifically for inflammation. And in this particular phase, we can treat the condition as if we are treating viscera, as if we are treating herpes zoster, measles, or even chickenpox. So that's what the plan can be thought of. Now, as far as the management is concerned, we can think of cooling herbs. At the same time, we can think of herbs that have laxative action, elimination of pitta. That becomes an important aspect as far as pacification of pitta is concerned. So keeping this line of treatment, if we start working on COVID-19, so that certainly has a wonderful potential in the treatment of various patients of COVID-19. So far I have talked about the management principle. Uh, my friend Dr. Sandeep will be talking about herbs and his unique approach of choosing herbs. So that will come next, and then accordingly we'll proceed with the conference. Thank you so much. Thank you for giving me time, Ranade ma'am. Thank you.
Thank you, Dr. Sabde. According to you, you have concluded we have to take into mind that when the disease happens, it is due to the weakened srotasa or the dhatu and aggravated doshas. So always try to boost your immune system. That is most important thing we have to think about this disease. So I will thank you very much. I will ask Dr. Shirwalkar, next presenter, who is also the MD in the Dravya Guna and who has also worked in this field since last 25 years. He is also visited many countries for the propagation of Ayurveda, especially in the Portugal. He is going every 1 month or 2 months and giving the lectures there also. He is very interested in Rasa Shastra, but he will talk about the immunomodulatory herbs and the anti-inflammatory herbs in COVID-19. I will hand over to Dr. Shirwalkar.
Thank you, madam. And I'm very thankful to, especially to Dr. Ranade sir, all my colleagues from IAA, and all the learned audience here. Welcome everybody. So actually here I'm going to explain my topic about COVID-19 and Ayurvedic perspective, then related with the antiviral, rejuvenator and antipsychotic plants in regulation to the COVID-19. Actually here with precision of the time, I will put some specific importance related to the medicinal plants, which are supposed to be very useful in this pandemic condition. Most of the researches have been done, they are going on also. And then keeping the time, keeping the limitation of the timings, I will try to elaborate as much as possible related to the medicinal plants. So Ayurveda has already scientifically proven effectiveness among number of the challenging health concerns. And during this pandemic, outbreak of the corona, herbal medicines are proving beneficial for its antiviral, immunomodulator and antipsychotic activities. So let's elaborate some of these activities. And everybody of us know that the causative organism is a novel coronavirus and call it as 2019. The number of the researchers had done until going on to find the palliative as well as curative remedies for this disease. Many people are absolutely searching the answer from the medicinal plants, and study approaches for these today's lecture is to elaborate antiviral properties of medicinal plants, also to improve the immunity to protect from the virus occurrence and reoccurrence. Also to recuperate mental health, to accept the challenges followed by the disease and the impacts on life from the pandemic conditions. So everybody is well known about what is happening. And as Dr. Ranade sir has mentioned that with this disease, with this pandemic, there are many mental conditions, right from stress to the anxiety and depression are also occurring. in relation with maybe monetary conditions or some other impacts. So now we are already known about the modalities of the coronavirus. That is we came across the mode of transmission of the disease, the role of the viral proteins, especially the NSPs also, and the infection pathways through the RA signaling component, which is S2 receptors. So now everywhere, everybody is asking about the S2 receptors, where the virus get attached and then the disease process starts also. As Dr. Mahesh has explained, that maybe we don't think about the virus, but we think about our pathological conditions which allows the virus to enter in the body. So keeping in those things also in mind, we really have to work for the antiviral viruses also, antiviral medicines also, and especially the immunity concern medicines. Also, we know that the viral NSP is able to block the host immune response, and that's why the immune concerns is very important over here. So primarily, the most important remedy is to prevent the virus entry and also the viral replication through the S2 blocking or the ORF-REM inhibition. So basically, if we block the virus at its entry point, then the next disease will be covered very easily. And that's why there are many treatment modules or the guidelines suggested by Ayush and ICMR, and those are also according to the disease progress, like as a preventive aspect also, then mild, moderate and severe symptoms also. So keeping those things in mind, we will follow those regulations also. But we are also facing many challenges during the disease conditions, especially the anti-cytokinic therapy to reduce the mortality rate, and controlling coagulopathy to reduce the lung fibrosis and to prevent the vital organ damage. So if we are able to control all these things, hopefully we can manage the disease process very easily and at the early stages, and it will help for the society also. So for time being, we know that Remdesivir is being used as antiviral, tocilizumab is being used as an anti-cytokinic medicine, like low molecular weight heparin, blood thinners, and then cortisones are becoming one of the life-saving contributors. Similarly, by now, we are also very familiar that the ashwagandha, amruta, tulasi, haridra, and haritaki are becoming very popular immunity supplements. And by now, I think not only in India, but all over the world, the huge demand of these plants, of these medicinal supplements have been increased. Furthermore, all the countries or the scientists are taking very hard efforts, especially for the vaccine. So let's see our first topic, that is antiviral herbal remedies. Many of the scientists have done molecular docking by using the computational methods for antiviral drugs, and we can have these references from the NIH and also from the CDC also. So the specific virus targets to block the receptor by using bioinformatics and computational tools, we can find out which receptor has to be controlled and which receptor has to be used for the further research conditions. There are many new technological developments which usually we are using in preclinical studies on the compounds with antiviral activities. So especially instead of wasting the time to make the many trials to go for the mass community and then lose a lot of time, nowadays we are using very simple preclinical studies, especially by these new technological developments. And also there is a conventional marker transfer studies which are useful to identify the molecular targets of the investigational drug. And by this method, we can find out which plants, which herbs are very useful for these viruses or such conditions. So here we have considered the chemical principles, and then these principles are chosen with their specific antiviral activity, which is reported after the molecular docking, and then we have searched for their natural resources. So the same chemical principles can be traced from other plant species, and then we have to select the specific receptor and its blocking molecule from the specific herbs. So like this, we get the framework of how to select the medicinal plant which may block the viral receptors. And then we can select the species which are already mentioned, especially in the respiratory system disorders, already mentioned in the Ayurveda. So like this, we can go to the root of the medicinal plant which already has proven thousands of years back, especially from Ayurveda. So here some of the plants we have selected. For example, the protein, which is one of the major protein, and then the inhibitors of those protein cells, one of the flavonoids called it as bacillin, which we found in shonak, that is Oroxylum indicum, and in Ayurveda it has also mentioned as antitussive, anti-asthmatic, and very useful in sepsis of the mods also. Another sesquiterpenoids, which is a sugetriol 3,9 diacetate, which we found in musta, or we can correlate it with the musta, that is Cyprus rotundus. And in Ayurveda, it has mentioned as useful in all the types of the fever, which is also antitussive, anti-asthmatic, and anti-inflammatory. So the next protein, if we consider, it is a 3-Cl-Pro and RDRP, that is NSP12, and inhibitors of these plants are andrographolide, didehydroandrographolide, which are the labdin diterpenoids, and which we found in Kalamega, that is Andrographis paniculata, which is one of the best plants explained in Ayurveda. And then the uses are like antipyretic, anti-inflammatory. This plant is also very good blood cleanser. So as Dr. Mahesh has explained the pathophysiology related with the blood, this plant can be the one of the best blood cleanser, which also block those type of receptors, which is also immunostimulant and antioxidant. So the next plant molecule, which is a betulonal, which is a pentacyclic triterpenoid, which we found in Bhurja, that is Betula utilis, and this is one of the less used Himalayan plant, and in Ayurveda it has mentioned also bhutagna, that is useful in infection due to germs and viruses, precisely we can say, which is also very good blood cleanser and anti-cough. So like this, the next protein is RDRP, that is NSP12, 3-Cl-Pro, helicase, and S2 inhibitors, which is a xanthone, that is methoxyxanthone, triptexanthosides D, diacetyl centapicrin, and corticosteroid, which we found in Kirata Tikta, that is Swershia chirata. This is also one of the very special plant from the Ayurveda and the best antipyretic plant, we can say. It is also useful in Pitta type of bronchitis, worked as anti-inflammatory, and one of the best blood purifier also. So we can say the best plant which has a bitter taste and the cold potency, like what we have to use in a typical type of samprapti related with the Pitta condition. This plant can be the very best preferable. The next protein is helicase, that is NSP13, and the ACE2 inhibitor, what we found with phylemblysin B and phylemblinol. So pentagalliol glucose and phylemblysin G7, which are the alkaloids, what we found in Amalaki. So everybody know this plant because of his rejuvenate. Sorry?
2 minutes are remaining. You can conclude later on.
Okay, the Phyllanthus imblica plant. Similarly, we have 3-Cl-Pro from the curcumin and the rasflavone from the Karkatashringi. Then GAGs inhibitors like Haritaki. And the most important plant that is binding free energies of S2 and the spike protein receptors from Vidanoids, that is Ashwagandha. So after this, we can go directly to the rejuvenator or the Rasayana plants. The basic main aim for the Ayurveda for the rejuvenation that they have mentioned in the terms of Vyadhi Saha, that is one who is capable of resisting the diseases. And then there are the simple words like bala, dhatu sara, or the ojas, that is the strength, tissue energy, which are the essence of the body tissues also. Then we can compare these innate immunity and acquired immunity, especially to the sahaja bala and then to the kalaj and yuktikrita bala. So here is one kind of hypothesis that to improve the innate response, that is immune stimulation and the enhancers, can be in the pre-condition, that is pre-stages of the disease COVID-19, then during and then post. Those will be Amalaki Bala and Nagabala for the pre, then Yashti Madhu, Vidanga Pipali, Haritaki, Haridra, Tulasi in the, during the disease condition, and for the post, Manduka Parni, Nagabala and Bala. And then to improve the adaptive immune response, especially to modulate the immunity and the adaptogenic plants, in similar way, in preconditions, Amrita, Shatavari and Shvetamusli. During will be Ashwagandha, Amrita, Kiratatikta, and for the post, Kapikachu, Punarnava and Jyotishmati. So here we are keeping one Ayurvedic concept of interleukin, especially intervention for the cytokine regulation, that is autoimmune response we can say. So here Ojo Vikruti, which leads to the sepsis, that is Dhatu Pak or the Srotasa Pak, eventually lead to the Chira Dosha Pak, that is septic shock. Here we can consider what are the cytokines, that is the hormonal messengers sourced from the T lymphocytes, which are coming from the allergy type of response. These are two types, Th1 and Th2, that is pro-inflammatory and anti-inflammatory. Here IL-6 promotes specific differentiation of CD4 T cells, and continuous over synthesis of IL-6 results in the hypergamma globulinemia and autoantibody production. And then Th2 response will counteract Th1 mediated microbicidal action to balance it, where we can say the interleukin war happens. Here the importance of Shamana Chikitsa, that is the Shamana herbs which did not clean increase doshas or vitiate the normal doshas, but balances the unbalanced doshas, especially Guduchi. So in this condition, we can correlate similar condition in female individuals by knowing Th2 phenomenon to reduce the risk of miscarriage, where a strong Th2 response is necessary to modify the cellular response in the utero. So we can say the Ayurveda has played an immense role in this condition, implementing the concept of Masano Masiko Athadravyas to avoid the miscarriage. So medicinal plants having potential immune modulation response from Masano Masiko Athadravyas may be useful in such conditions, which are Shakabija, Shatavari, Devadar, Manjishta and Sariva. And then finally, we will just take a brief look in antipsychotic plants. We all know about the Prajna Parada, so which causes the incapacities of Dhidritya and Smriti, and that reflects through the fear, anxiety, depression and insomnias. Everybody know, and it has been proven that Rasayana drugs reduces the anxiety to keep the mind calm and cool. And here some of the plants which are useful here, like memory enhancers, Brahmi, Mandukaparni, Shankhapushpi, Jyotishmati, Vacha, Guduchi. Stress relieving, Ashwagandha, Brahmi, Jatamansi, Dhamasa, Kushmanda and Guduchi. Anti-anxiety will be Brahmi, Mandukaparni, Tagara. Anti-depression will be Ashwagandha, Brahmi, Tagara. Brain stimulants will be Kapikachu, Vacha, Jyotishmati. Dopamine synergy will be Kapikachu, Ashwagandha, Brahmi. And anti-demyelination will be Kapikachu, Shankhapushpi and Brahmi. And the last slide, here another concept we can put, that we need some mood elevation, positiveness, happy thoughts, reducing mental confusion in this such a condition. So we can use these plants in the morning, especially Vacha, Mandukaparni, Brahmi, Shankhapushpi and Jyotishmati. And for the evening time, we can utilize the concept of like keeping calmness, using anti-anxiety medicines, reducing mental irritation, and also can inducing some mild sedatives like Tagara, Ashwagandha, Jatamansi, Dhamasa and Kushmanda. So with this intention, I will conclude my lecture here, and thank you everybody for patience listening. Thank you. I will hand over to Dr. Ranade Madam. Thanks everybody.
Thank you very much, Dr. Shirwalkar. You have explained your all these herbs in a good manner, and we would like to go further with this because we have a limited time. So I am extremely sorry to disturb you. but you can go. You have given a good information regarding all the herbs which are very important in the COVID-19. Our next speaker is Dr. Sunita. Manjiri is there. Hello. Manjiri is there.
Yes, ma'am. Manjiri ahe.
Huh.
Manjiri is there. Now she will take the.
Okay, okay. So our next speaker is Manjiri Joshi, Dr. Manjiri Joshi, and she is practicing in this Ayurvedic field since last 20-25 years. She is also the senior faculty member in International Academy of Ayurveda, and she is also visited many countries, including the Israel, to give the lectures on Ayurveda to different countries. I will hand over to Manjiri for the further Rasayana treatment in the COVID-19. To Manjiri Joshi.
Thank you, Ranade sir and madam. Can you see the screen?
Yeah, but we cannot see you.
We can't see you.
We can see the screen, but not to you.
Okay. Yeah, but if you can see the screen.
Screen. Yes. Now it has come. Yes.
Yeah. You can start your lecture.
Go ahead, please.
Go ahead. You can start your lecture.
Yes. Thanks, Dr. Ranade sir and Dr. Ranade madam for giving me this opportunity. Thank you, Dr. Mahesh and Dr. Sandeep for your valuable inputs on role of Ayurveda in COVID-19. Now, Swasthasya Swasthya Rakshanam is the main aim of Ayurveda. Prevention is better than cure. So, Ayurveda has elaborated the ways to prevent the disease or the maintain the health. So, this prevention has multidimensional aspect, which includes Dinacharya, Rutucharya, Ratricharya, yearly Panchakarma suitable for individual to elimination the doshas out of the bodies, yoga, pranayam, meditation for mental health, and consumption of rasayan to improve the immunity. Rasayan is one of the 8 independent branches of Ayurveda. We begin to age the moment we are born. So all human beings have a natural urge to live. Living a healthy, disease-free life is more important than just living a long life. To achieve this goal, as I mentioned above, Rasayan is the way to achieve the disease-free, healthy lifestyle. The word Rasayan consists of 2 words, Rasa and Ayana. Here, Rasa refers to the nourishing fluid to all the body tissues, and the ayana means proper supply. So Rasayan refers to any drug, therapy, diet or regime that promote proper supply of nutrients to the body tissues and hence delay the aging process and promote and prevent the diseases. So this is nothing but the rejuvenating and improving immune system. The concept of immune system is closer to the Ayurvedic fundamental principle of Vyadhikshamatva, Ojas and Bala. All these 3 are closely related to each other. Vyadhikshamatva is the body's fighting power against the disease, any infection or any injury. The fighting power is dependent on the individual Sharira Bala and Ojas. So we can say that immune system is nothing but the Vyadhikshamatva in Ayurveda, which is completely dependent on the Sharir Bala and Ojas. Now there are 3 types of Sharir Bala. One is the Sahaja Bala, the Bala which comes from the parents and is inherited. It is similar to the innate or natural immunity. Second one is the Kalaja Bala. This Bala is dependent on the daytime, season, age, sex, even the place of birth. The third one is the Yuktikruta Bala, which is the Bala which represents the acquired immunity. that an individual acquires after the birth. Ojas is the essence of all the body tissues ending with Shukra and is located in the heart and pervades all over the body and control the working of the body. So benefits of the Rasayan therapy in improving immunity is very important. Rasayan deals with rejuvenation of the body, physical body and well-being of the psyche, that is the mind. It helps improve the self-immunity. So as per ancient texts, the benefits of Rasayan are Dirgham Ayu, Smruti Medha, Arogyam, Taruna Vayam, Pradha, Varna Swara, Dehendriya Balodayam, Vaka Siddhi and Kanti. So in short, we can achieve complete re-establishment of the worn out cells and tissue and bringing a normalized digestion, assimilation and metabolism of nutrients with Rasayan. It helps to rejuvenate the body and thus delay the process of aging. Aging is a continuous process with respect to time. The natural aging is normal, but Ayurveda Sushrut says has mentioned about the early aging, that is Akalaja, in which there are early signs of aging. There is early degeneration of tissues, sensory organs, body strength, enthusiasm, wrinkles, and baldness at an early age. So here the chronological age of a person may not be equal to his biological age. Rasayan offers a multidimensional enrichment of bodily functions. Thus, it acts by protecting life and strength, preventing atrophy and decay of the tissues, and curing many diseases. So, there are essential parameters for selection of proper Rasayan therapy. First important one is the constitution of the person. Particular herb or medicine or therapy is specially suitable for particular person. We need to have a thorough analysis of individual constitution with Ayurveda parameters, which includes Agni Pariksha, Sharir Bala, Vyadhi Bala, etc. Then consideration of age is very important. To start the Rasayan therapy at an early age is more beneficial. So one must start Rasayan therapy irrespective of any disease to delay the aging process and improve the immunity. Specific need of individual is also very important because there are few Rasayan therapies which have specific probable action on the body. This characteristic can be used to select Rasayan individually. For example, if the person is suffering with respiratory diseases, then Ayurveda can advise that individual specific Rasayan which will be improve the immunity of respiratory system. Now, current scenario of COVID-19 and role or effectiveness of Rasayan. Worldwide, the battle against COVID-19 has turned into complete lockdown. The whole world was and is in standstill condition. Until date, we did not get any definite cure for the deadly virus. So those who have good immunity can fight the virus easily. Now, I would like to discuss the ways to improve the immunity with respect to COVID-19. So here we need to think about two types of immunities. One is overall immunity and other specifically to improve the respiratory immune system. So for overall body immunity, which is applicable to all, the immunity can be achieved by following dinacharya, fine tuning of rutucharya, proper diet, good exercise, in short, following a healthy lifestyle mentioned in Ayurveda. But in Ayurveda, diet has been mentioned as Rasayana, called as Ajasrika Rasayan. So I would like to focus on a few concepts of diet with respect to Rasayan therapy. Healthy food habits and nutritious diet have been considered as the part of Ajasrika Rasayan. The nourishing, healthy, suitable food for individual is the best immunomodulatory therapy. Though the results with diet therapy are slow, diet is best healing and Rasayan therapy. Awareness among the society about the role of healthy food and food habits has to be reintroduced, keeping in mind the present altered lifestyle of people globally. Milk, ghee, honey, legume, grains, almonds, spices such as turmeric, clove, asafoetida, cumin seeds, etc. must be part of everyone's diet. I feel that this concept of healthy diet or food as rasayana must be introduced to everyone right from the birth. Ayurveda has very different concepts of diet and nutrition, which makes the science very special globally. The second way to achieve the overall immunity is by using herbs suitable for individual constitution like ashwagandha, shatavari, amalaki, haritaki, brahmi, etc. And the third way to improve the immunity is doing oil massage regularly is best recommended in the ancient texts. Now, coming back to next is to improve the immunity.
Dr. Manjiri, you can conclude the session.
Yes. To improve the respiratory system, there are three ways. One is to use the single herbs which work on pranavas throtas like tulsi, the turmeric, lemongrass, wet ginger, dried ginger, cinnamon, amalaki, pippali, bruhati, draksha, bhringaraj, ela, etc. Then there are few combination herbs which can be used to enhance the immunity of pranavas throtas like Kantakaryavaleh, Chavanprash, Pippalyaso, Rasayan Vati, Agasti Rasayan, Dashamul Haritaki, and Vasantakalpa. There are few therapies in Ayurveda which are beneficial to increase the immunity of respiratory system, and the most important is Nasya treatment. So Pratimarsha Nasya will be very beneficial to improve the immunity of respiratory system. Then the probable action of the rasayan drugs is Ojaskara, Strotoshodhan, Balya, Jivaniya, and Vyadhikshamatva Niyamak. So to conclude my session, I would like to summarize the following. Healthy and nutritious diet is very essential throughout the life. Build good eating habits. Overall immunity and specific immunity of Strotasa both are important in fighting the diseases. Following regular healthy diet, daily massage and use of single herbs to improve your overall immunity are essential. And to develop immunity for the respiratory system, use of herbs to boost the respiratory immune system, Naimittik Rasayan drugs, follow Nasya as a part of daily schedule, and of course don't forget to follow a healthy diet. Thank you very much.
Thank you very much, Dr. Manjiri. Our next speaker is Sunita Chaudhary. I will request Sunita to conclude herself within means to start and complete take 10 minutes only instead of 15, because everybody wants to hear Dr. Picha also. So it is better because Manjiri has explained very nicely about the rasayana of these through the food and herbs also. So thank you very much, Manjiri, and I will ask next speaker, that is the Sunita, who is also the senior member of our IAA and who is in this field since last 30 years. And she is MD in yoga and she is expert and she has visited many countries to give the lectures on yoga. So I will ask Dr. Sunita to talk about its effect, and with the 10 minutes only, I'm extremely sorry, Dr. Sunita. Please start.
Thank you. Am I audible?
Yeah.
Yes, yes.
Yes. Thank you, ma'am, for the introduction, and thanks for giving this opportunity. My time is reduced to 10 minutes, but I'll take the opportunity to convey best way. The lifestyle is a basic factor in our life, and on the 25th March, when our Prime Minister said, "Mere pyare bhai aur bahino," and everybody got stuck because our life got stuck as a lockdown on from that day onwards. and now we are on the unlocking of the this lockdown system, and everybody's lifestyle has been changed from the March onwards. And this is a very I think relevant point to discuss about the lifestyle, because everyone is sitting at home and working from home, and there most of the people are at home. Housewives are having a spree on experimenting in the kitchen, so food indulgence and everything is going on. So what is a lifestyle? This term, I will not go much into the detail because I have not much time to describe about everything. I'll talk about the Ayurveda. Ayurveda says the ahara vihara, that is diet and exercise, our day-to-day daily regimen, achara vichara, behavior and thinking patterns that influence our dosha, dhatu, mala, agni, mind, that is our biological workup in the body, and mind and our soul. It is everything is affecting by this our day-to-day lifestyle. And purpose of this our Ayurveda is having a swastha avastha, that is the optimum level of the health. And now maintaining that optimum level of the health, our immunity has to work constantly, because without that we cannot maintain our health without having that immunity on the optimum level. So this lifestyle will be any problem? Am I audible?
Yeah, go continue.
Preventive aspect, that is maintaining good health, adjuvant during disease management, and rejuvenation, that is rehabilitation. So lifestyle works on every phases, on every stages of the our life and our this and the disease. So it's not only the for the preventive.
Yeah.
Yes, Dr.
Your
Mahesh.
slides are not visible.
Yes.
Your slides are not visible. Can you check that?
Yeah, but I can see.
Not we cannot see.
If you can do it,
Without slides.
we'll continue the same.
Yeah, that will be okay.
5 minutes more.
Maybe, yeah, because okay, I'll go on. I don't know what happened.
Continue.
So
Yeah.
Dinacharya is given by Ayurveda from getting from the and going to the bed. So everything has been described at the point of view that maintaining that optimum level of the health, that means optimal level of your immunity. So these are the things which have been described by Ayurveda. We know. I will just talk about the two things. Nasya, which has been recommended by Ayush because it is giving a filming, oil filming on our mucosal membrane of the nasal mucosa, and protecting from the invasion of the viruses. So that is the utmost important thing to follow every day. Then gargling with the oils, Ayurvedic medicated oils, Gandusha it is called, hot water, turmeric and salt water gargling. That is also having the same effect on our oral mucosa for prevention. And then steam inhalation and so on. And the diet already Dr. Manjiri has described. I'm so sorry I have to skip the matters. There are a lot of things to share, but it is everything. I will say that it is our circadian rhythm which has been taken care by this Dinacharya and Ritucharya concept by our old acharyas, and which is a Nobel Award winning concept, which has won the Nobel Award by the other person from the Japan. So seasonal regimen. So that is important of why we should follow this all the regimens. And behavioral conduct is called as a Achara Rasayan. It has been given the designation as a Rasayana. So that much important has been given by the Charakacharya that we have to follow this every day as having the effect as an immunity on our body. As in yoga, it is said as Yama and Niyama. We have to follow every day. And because of the Prajnaparada, what happens every day, we are having these different indulgences on the food because the working and the sitting at home. And because of the Prajnaparada, the Vadi immunity is not getting maintained. And the stress on the cellular level and our mental level is generated. And that is how the immunity factor has to be taken care by this, following this daily regimen and seasonal regimen. Yoga has aptly said that mind and breath correlation It is a bridge between mind and body. The pranayama has said to be bridge between body and mind, and they have given the importance to the pranayam and we can follow this yogic regimen also in this pandemic as a preventive aspect also. During the mild and moderate symptoms also we can follow, and after the as a rehabilitation also we can follow this regimen, yoga and Ayurveda regimen. Lot of things have been described at the pranayam. Everybody knows asana, some simple asanas, and the meditation, which gives effect on the balancing effect of the right and left side of the body. That is our sympathetic nervous system and parasympathetic nervous system is getting balanced, and all the systems you can see all the body systems are getting balancing effect on our body, and that is how this immunity is been maintained at optimum level. So this has been the message by our acharyas since 5,000 years. But I think we have not given the importance till date. But now this pandemic, global pandemic, COVID-19 has given us opportunity to think over about it. And we are now in India, we can say, and even many people, researchers are saying that maybe this is a reason why India has a low death rate in global pandemic of COVID-19. So this is a takeaway message that follow the dinacharya and rutucharya as a daily regimen and seasonal regimen, everything, all the code of conduct of our life. As Ayurveda says, it is a Ayushaha Veda. It is a science of your life and not for the disease. So this is a message for everyone at a global level. I conclude my slide by saying this yogic verb that Sarve Santu Niramaya. So everybody will be at having a good health and good peace and good mind. Thank you very much. Thank you IAA for giving this opportunity and putting my words in front of all the viewers. Thank you once again.
Thank you very much, Dr. Sunita. You have mentioned very briefly but very correctly everything regarding the how we can prevent all these things. I am very much thankful. I will go to the next speaker, Dr. Picha, who is a cardiologist. He is from Austria. He is the director, chairman of the International Maharishi Ayurveda Foundation since last 10 years. And he is a master in Transcendental Medicine. He will talk about meditation. He will talk about the PM now. So over to Dr. Picha. Welcome, Dr. Picha.
Yes, thank you for inviting me. Dr. Sunanda Ranade and Professor Subhash Ranade. It has been a wonderful time to listen to all these experts on this topic of Ayurveda and COVID-19. I will just share my screen. As you mentioned, I will focus, as some of the other speakers have already done, on the aspect of consciousness, the mind aspect in handling COVID-19. And I think we are all aware that psychosocial stress has a negative influence on our immune system. And of course, it has intensified during this current pandemic. And we are all aware that psychosocial stress causes a large number of stress disorders, specifically post-traumatic and traumatic stress disorders, anxiety, depression, and suicide, besides weakening the immune system and worsening any case of COVID-19 disease. I would like to speak a little bit in my first part on the concept of consciousness from traditional Ayurvedic science and modern science. And then I will introduce Transcendental Meditation, which is a yogic technique from India, and present some research underlining the effect on any infectious disease. Consciousness is usually sort of the conscious mind or the unconscious mind, but according to Vedic science, consciousness is much more. It's basically the essence of everything, and consciousness largely determines how we cope, how our physiology can cope with stress and stress-related disease, because you can't switch off stress, but you can change how the body copes with stress, the stress resilience. And I will focus on that. And I think we're all aware, these are all Ayurvedic experts, and the Ayurvedic word for health is interesting to analyze, svasthya, because this has in itself sva, the self, and sta, established. So health really means to be established in one's own self, and self means our atma, our consciousness. And so even in the word health, svasthya, this concept of consciousness being the primordial, the main pillar of handling anything in the physiology is already laid out. Here you see just a little bit of how the physiology interconnects the nervous system, the endocrine system, and the immune system through neurotransmitters, hormones, and cytokines. Many of those have been mentioned by previous speakers. So any stressor like fear and anxiety during this COVID-19 pandemic interacts with all these three systems, and of course the immune system. And what is the result? That any stress that occurs leads to disease, and the disease again increases the level of stress. So you have here a vicious cycle that reinforces the problem of the disease. And here is one example in my area, cardiology, when we start here on the right side with anxiety that you have, for example, fearing heart attack or anything, then this causes the sympathetic nervous system to elevate, and this influences the immune system through leukocytes and the spleen, and they kind of release inflammatory monocytes, and they can then in the coronary arteries cause an infection of the atherome, and then causes thrombosis and heart attack, which again increases fear. So this is a vicious cycle. Just one example from the field of cardiology, which also explains why during this pandemic we see more heart attacks and stroke as a side damage due to the fear and anxiety. Here is something interesting from modern physics, because since Einstein, there is the wish to theorize a unified field that is the essence of everything. You know, we have organs, lung, liver, they are composed of cells. Each cell has molecules and atoms, and in the center the DNA. And this molecule consists of atoms, and the atoms, they are in themselves composed of particles. And the lower you go in the Planck scale here, then the scientists speak about fields, not of matter, both fields and matter fields. So everything seems to be a field, and ultimately everything emerges in the unified from a unified field. There are several unified field theories, but how they describe it is very much similar to the description of consciousness, as it's the essence of everything, Atma, Brahm. It's self-evolving, and it's silent and dynamic at the same time. So this is quite interesting to take this link, and Maharishi Mahesh Yogi was very fond of this relation. And I just want to introduce to you another approach from modern science, and connecting is to Ayurveda and traditional science. Dr. Tony Nader, a neuroscientist, on Mahesh Yogi's guidance, looked into the relationship between the Vedic hymns, the Veda and the Vedic literature, and the physiology. And he found an exact match between the hymns, which are reverberations of consciousness, and the human physiology. Here, for example, Rig Veda has 192 suktas in the first mandal. And we can't go here now in much detail, but just to give an impression, a glimpse, you see here all the suktas of Rig Veda, of the first mandal, and how they relate to the spinal nerves and to all the nerval fibers of the brain and the spinal cord, how they come out. This is very interesting, the match in function, number, and structure with the human physiology. Same with the field of yoga, which has 4 chapters, and this corresponds to the 4 lobes of the brain. And you can see even each sukta or each sutra here, the Yoga Sutras of Patanjali, they are matching in each of these gyri of the brain cortex, and they match here in length and function to the morphology of the gyri. So this is something interesting to look at, that modern science discovered that Veda itself is found in the human physiology. So the human physiology is just an expression of Veda, of consciousness. So this explains a little bit how modern science sees consciousness in the human physiology. Now I'd like to introduce to you one type of meditation. It's called Transcendental Meditation, which Maharishi Mahesh Yogi has brought to the West. It's a traditional samadhi technique, we can say, from the 8 limbs of yoga. It's traditional. It can be easily learned within 5 days, and it's practiced in sitting with closed eyes twice a day, 20 minutes. So everyone from young child to old people can learn it easily. And one experiences this restful alertness, this silence and dynamic, our own consciousness, pure consciousness, very easily. And it's well researched. More than 300 scientific studies confirm the effectiveness of transcendental meditation in various diseases. And I want to focus here a little bit, of course, on infectious disease, COVID-19. And some of the findings show that transcendental meditation, if practiced regularly, mitigates any mood disturbances, which is important during this time. It increases the stress resilience, and it strengthens the immune system. And I just want to show you a few findings that have been done over the last 10, 20 years. For example, it decreases mood disturbances in the area of anxiety. The blue bar is always the group that practice transcendental meditation. These are controlled studies. So it reduces anxiety, depression, anger, confusion, and fatigue in this study. Another study shows that transcendental meditation reduces trait anxiety, which is very important during these days. People are very much in fear. And you can see here, this is the effect size. That means how effective any technique, placid, other relaxation, mantra meditation, other meditation. This is a meta-analysis from 146 studies, and it shows the transcendental meditation has here the biggest effect size. In another study, focusing on immune system, looking at natural killer cells, B lymphocytes and T cells, all important in fighting viral infections. You can see here in a controlled study in the Journal of Yoga from 2014 that transcendental meditation increases the immune response. You have more of these immune cells in your body when you practice regularly transcendental meditation. And here is an older study, it's 1987, but it's a large study done in USA, in Iowa, where a health insurance looked into the number of hospital admissions in people who practice transcendental meditation. These were 2,000 practitioners of transcendental meditation, and there are in all disease areas less numbers of hospital admissions. But here you can also see that infection of nose, throat, and lung is decreased. The blue bar is again the transcendental meditation group, and also infectious diseases, much less hospital admission. So it really shows that transcendental meditation is highly effective in helping, managing, and coping with COVID-19, both from the immune response, but also from the level of consciousness to reduce fear, anxiety, and increase stress resilience. So since time is short, I come already to my conclusion and summary, which is that managing stress, fear, and anxiety should be really one of the main pillars to reduce damage of any pandemic. And all speakers here have confirmed this approach, and I just can underline this. And here specifically, the daily practice of transcendental meditation, which can be easily learned in a few days, enhances stress resilience and strengthens the immune system to fight any infection, specifically COVID-19, reduces even the chance to get it. It's preventive, and it leads to fewer hospital admissions. So thank you very much for the organizers to invite me to this wonderful seminar, and looking very much forward to continue to collaborate with you and all the esteemed speakers here. Thank you and namaste.
Thank
Jai
you.
Guru.
Thank you. Namaste. Dr. Picha, you have given a very nice speech, and we are very thankful to you for giving your Transcendental Meditation very well to all our members. So we will collaborate and we will try to enhance all these things in our curriculum and everywhere. So thank you very much. And I am very thankful to all the participants who have given in short their thoughts and regarding all these things. So thank you very much to all of you. Namaste and good afternoon. Bye-bye.
Bye-bye. Yesterday the lights went out. That's why
We were worried.
I had to quit the meeting.
Oh.
Yeah, this happens here on Thursdays many times in Pune because of heavy rainfalls and other things. So there is a quick load shedding. So the lights, while we were talking, the lights went out.
So we were lucky today that everything worked out nicely.
Exactly.
Very well.
Nature support.
Yeah. Correct. So,
Great.
Due to your presence.
yeah.
Yeah, I think the presence of everyone,
Yeah.
because if nature feels this is important, it
Yeah.
will support us. So it's a
Correct. Thanks.
contribution of everyone.
Thanks to all the presenters. Thank you very much.
Acha,
Yeah.
yeah, I would like to just share one thing that all the session has been recorded and we are trying to post it on YouTube. So it will be a pleasure to share the link to everyone interested about it.
Send us a link and it will be easy.
Very useful. Yeah.
Perfect.
Because Maharishi International also has a news bulletin, so we can publish
share
the link into the news bulletin.
Yes, we will do. We happily do.
Exactly.
Awesome. Thank you.
Thank you, sir.
Thank you, sir.
Thank you.
Manjiri, तुझी एकही स्लाइड दिसली नाही.
हो ना, आणि मी पण दिसले नाही का?
तू
दिसली.
दिसलीस, पण स्लाइड्स दिसल्या नाहीत.
आणि सुरुवातीपासून तू दिसली नाहीस असं झालं.
हो.
एकदम तुझ्या स्पीचच्या वेळेलाच दिसलीस.
काहीतरी गडबडच झाली मग ते.
सुनीताच्या पण स्लाइड दिसल्या नाहीत.
ते शेअरिंग काय होत नव्हतं. मी 2 वेळा ट्राय केलं.
मी खरं आधी आणून ठेवल्या त्या स्लाइड स्क्रीनवर आणि शेअर करताना काय गडबड झाली कळलं नाही मला म्हणजे.
कारण एकही स्लाइड दिसली नाही.
हो ना, आणि खूप
सगळ्यांची छान
छान
झाली.
छान तयारी तुम्ही खूप चांगली केली होती. चांगलं झालं. Really nice.
Thank you. Thank you, sir.
थँक्यू.
थँक्यू.
Okay. Thanks.
Okay,
Bye-bye.
bye.
Okay. Acha.
Bye.
Thanks for the host, Supriya.
Yes.
She is looking into picture only, not speaking.
Hello, Supriya. नाही आहे का?
Unmute kara.
Unmute.
मला पण छान ऐकायला मिळालं सगळ्यांचं. थँक्यू.
Very nice. We said thanks for the host.
Thanks for the darshana of the host.
So we are in time, na? Right?
सर बंद करायची का तुम्ही कराल नंतर?
No. Close.
महेश
Oh, नाही बंद करतो मी.
तू
Okay.
प्लीज सोडते. हा
महेश ऐकायला.
Yes. कोण काय बोलतो? End करू session?
Yes.
Okay. Thank you everyone.
Thank you.